Dear students, let us discuss with the ENT segment. The first MCQ, I say, is one of the easiest MCQ. 40-year-old male with a chronic history of bronchial asthma, sinusitis, Samson's tract. Patient is having history of Samson's tract. What is Samson's tract? There is a bronchial asthma. Patient will be having nasal polyps or history of sinusitis. Which drug is contraindicated? So yes, which will be the drug will be contraindicated? Aspirin. It is sensitivity to aspirin. This MCQ can be repeated. They can ask you why. Why this phenomena is there? Why the patient symptoms are precipitated after taking aspiration? It is due to IgE release. Just remember, this is important previous year MCQ. Bronchial asthma with history of nasal symptoms, with which drug is contraindicated? That is here aspirin. Taking this drug, all the symptom will be precipitated. That is due to IgE release. This question can be there. Coming on the next MCQ, straightforward. 35-year-old male patient coming to the OPD with history of cold and cough with loss of smell and taste. Somewhere we are suspecting COVID. Patient anosmia is one of the important finding, but just remember, COVID, if the examiner asks you most common ENT manifestation, it is here. Sore throat. It is sore throat. Most common ENT manifestation of COVID will be sore throat. Then, and if the examiner asks you non-ENT manifestation, non-ENT is your fever. Yeah. So patient is coming with cold and cough with loss of smell. We are suspecting COVID infection. We will go for nasopharyngeal swab for COVID test. Clear. Coming on the next one. Syphilis affects which part of the septum? Again, this is a little bit converted MCQ. Syphilis affects, if you go with the literature, syphilis affects the bony part as well as cartilage. Clear. But if we want to choose one option, I will be going with the bony segment and understandable. In the examination, in the MCQ, they will not give you both the option, but if given, go for bony option. So syphilis affects the septum. It damages the bone, it damages the cartilage, leading to your septal perforation. Always remember this point. Clear? Coming on the next one, question number 4. Electrode. MCQ dedicated to rehabilitation of a deaf patient. Upcoming FMGE beta, just revise these MCQs of rehabilitation of a deaf patient. Always make a concept. Conductive deafness, we give hearing aid. Conductive deafness, we are giving hearing aid. In sensory deafness, it is your cochlear implant. Cochlear implant. In neural deafness, it is your brainstem implant. Let us revise few basic points. Cochlear implant, brainstem implant. Where is the cochlear implant kept? Cochlear implant is placed in your scala tympani. Revise this concept. Cochlear implant kept in scala tympani via round window. If examiner asks you, it is kept in. It is your scala tympani kept via round window. That is cochlear implant. What I am asking you is brainstem implant. What is the difference in the cochlear implant and brainstem implant? Brainstem implant are kept in lateral recess of fourth ventricle. Important difference. Cochlear implant, scala tympani, and brainstem implant, lateral recess of fourth ventricle. They can ask you, cochlear implant stimulate which part of the auditory pathway? So it stimulates your 8th nerve. It stimulates your 8th nerve. While the brainstem implant, they stimulate the cochlear nucleus in the brainstem. Clear? This is an important point. So scala tympani with the right answer for cochlear implant. And lateral recess of the fourth ventricle will be your right answer for brainstem implant. What is the next MCQ? 65-year-old diabetic patient complaining of 2 days history of left jaw pain followed by rapid onset of neck infection. Diabetic patient. Important golden rule. We people have discussed. We all in the classroom. We have discussed all these points. Diabetic patient. If the diabetic patient is there in the MCQ, if the MCQ is from ear, always make the diagnosis of malignant otitis externa. So diagnosis will be going in the favor of malignant otitis externa. MCQ from nose. If the MCQ is from nose, it is going in the favor of mucormycosis. Mucormycosis. MCQ from oral cavity, like this MCQ question I have given, the patient is having some jaw pain, something will give the oral cavity, will be going in the favor of Ludwig abscess. Will be going in the favor of Ludwig abscess. Then again, ear, malignant otitis externa, nose, mucormycosis, Ludwig abscess will be here. submandibular abscess. So patient is having some swelling below the chin. It is going in the favor of submandibular abscess. Abscess, expect one MCQ from the abscess segment. Parapharyngeal abscess is the most common abscess of head and neck. It is in the lateral wall of the pharynx. And what is the lower limit? With advice with me on this platform. Parapharyngeal abscess is extending up to hyoid bone. What is the treatment? IND. We give incision and drainage. Where we give IND? We give IND along anterior surface of sternocleidomastoid. Retropharyngeal abscess. In retropharyngeal abscess, we give a incision along posterior surface of sternocleidomastoid. They can ask you, up to what level your retropharyngeal abscess extend? Retropharyngeal abscess is extending up to bifurcation of trachea. Two important points. Parapharyngeal abscess extend up to hyoid bone. What is the treatment? Incision along the anterior surface of sternocleidomastoid. Retro is along posterior surface of sternocleidomastoid, and retropharyngeal abscess extend up to bifurcation of trachea. What is quinsy? They can ask you the definition of this option. Quinsy, peritonsillar abscess. Every student listening to me, they can ask you in your FMGE examination, they can ask you, what is the definition of it? Quinsy is a abscess, peritonsillar abscess, between capsule and superior constrictor. Just revise with me, it is between capsule and superior constrictor. Capsule and superior constrictor. Done. Coming on the next one. This is a little bit tricky MCQ. Now I will help you out to crack this question. A patient is here with positive fistula test, but now the test is coming negative. It means that patient is having extensive severe cholesterol, which was creating the fistula, making the test positive. Now test is coming negative. Why? Because of extensive cholesterol. So can I make a definition? Can I make a diagnosis? Extensive cholesterol or the later stage of cholesterol? What is the complication? One of the important complication is later stage of cholesterol. It can be your sensory neural deafness. It can damage the inner ear. Labyrinthitis can be one of the important complications. Now, what is the expected finding? So in the late stage of your CSM, that is cholesterol, what can be the possibility? One, the examiner is giving you true positive or true negative. Now, the patient is not just regular. It is your unilateral condition. Patient high probability in the last stage of cholesterol. Unilateral severe deafness can be found. Because this patient is a complicated cholesterol, complicated CSM, the diagnosis going in the favor of severe deafness. And whenever there is a severe deafness, there is a high probability that we can get false negative in this test. Whenever there is a unilateral severe sensory deafness, there is a probability of here false negative. So option A can be expected finding of this patient. Again, I'm highlighting this point. This can be, the patient can have true negative because it is mainly an involvement conductive deafness. So it can be true negative, but because it is a severe last stage, or can say severe stage of cholesterol, the patient high probability of severe deafness in which we can have false positive. So little bit you can say is a difficult MCQ, but better choice will be option A. Better choice, option A. It can be option D, even option D to negative, but I will go in the favor of option A. Okay, tricky MCQ. Question number 7. In view of a given slide, what is the least possible cause? What I'm showing you some necrotic lesion over the nose. That is, you are going in the favor of mucormycosis. Let us read the option. The first option, uncontrolled diabetes. It's one of the important predisposing factor. Broad spectrum antibiotics. Neutropenia, yes, it can be one of the predisposing factors. Long use of steroid, yes. So option A, C, and D can be there. But broad spectrum antibiotics, no. This is a big list of all the predisposing factors for mucormycosis. It can be organ transplantation, it can be antibiotic location, overuse of steroid, antifungal. These all are the important causes, but not antibiotics. Always remember, among 4 choices, B option is least associated with here, mucormycosis. Okay, coming on the next one. A patient or belt palsy, one of the easiest MCQ. Deviation of the face will be, obviously, it will be entire side, on the same side, entire face on the same side is involved. Clear? I will label it as one of the easiest MCQ. Bell's palsy strikes success rate is very high. It around 85%. If you start, just remember, if you start steroid and antiviral within 3 days. If you start steroid and antiviral, that is acyclovir, within 3 days, there is a high probability of success rate, that is 85%. But if the patient is coming after 3 days, very important MCQ fix your exam, they can ask you the patient is coming on the 9th day, what to do? Will you prescribe only steroid or only acyclovir or both? Both. Irrespective of the day, we prescribe, but the best success rate will be if given within 3 days. Understandable. Which part of the facial nerve is involved? Always remember, it is labyrinthine part. It is labyrinthine part which is commonly involved. Clear? Coming on the next one of the easiest MCQ. All these are the important topics for your upcoming examination. So please go through these topics nicely. What is function of electrical circuit? Let us do a fast revision. Cochlea, it is your hearing. If damage, that is your deafness. Electrical circuit is a central part of vestibule. Central part of vestibule related with linear motion. Linear motion. If the patient if there is any abnormality in electrical circuit, loss of linear balance, patient will be having ataxia. Always remember what is the important prime symptom of electrical circuit is ataxia. If your semicircular canal involved, that is superior, posterior, or lateral, it is loss of angular balance. So what is angular balance going in the favor of? It is semicircular canal. Linear is your electrical circuit. One more important point, electrical circuit. What is the sensory organ of electrical circuit? The examiner can ask you. The answer will be macula. Macula, electrical circuit. Clear? So this is the important organ of cochlea is a sensory organ of cochlea. Semicircular canal, we have crista, pupil. Clear? So these are the important sensory organ of my inner ear, sensory organ of inner ear. That is revised in a nice way again because I'm expecting one MCQ. Cochlea, it is organ of cochlea. Organ of cochlea. In electrical circuit, we are having macula, otolith membrane. All these words are related with electrical circuit. And if the examiner asks you semicircular canal, the crista or cupula, these are the sensory membrane. Yeah? So electrical circuit related with your linear balance, semicircular canal related with the angular balance, related with the angular balance. Question number 10. Keep my words. One MCQ on angiofibroma always there. They have clause. Which are the keywords for angiofibroma? Everybody, it is your 14-year-old boy. It is 14-year-old boy. Patient will be having, one second, patient will be having 14-year-old boy. Patient will be having epistaxis. Patient will be having epistaxis. Young boy, angiofibroma, which is not to be done. Biopsy. Always remember biopsy. It means option A, option C, rule out. Chemoradiation. Chemoradiation will be to reduce the size of the tumor. I am asking what is the next line in the management. I will operate, but before surgery, I will go for CT. Can you tell me in the chat box what will be the important finding? The important finding on CT examination will be Hallman-Miller sign. You will get Hallman-Miller sign on CT examination. Clear? Treatment is such. They can ask you which artery is embolized. Always remember angiofibroma, we embolize internal maxillary artery. Internal maxillary artery. Clear? Coming to the next one, question number 11, one of the easiest MCQ. Widening of the cartilage part of the canal. What are the options? Options are autoplasty. Autoplasty is your repair of the ear, external ear. Myringoplasty is type 1 tympanoplasty. Tympanoplasty is a repair of middle ear. So it is nothing to do with your external auditory canal. So answer is A or D. External auditory canal, myoplasty. Best option. I feel again it is one of the easiest MCQ. Clear? Coming to the next one, occipitomental. First of all, tell me what is occipitomental. Occipitomental view is here. What is it? Occipitofrontal. If the examiner asks you occipitofrontal, that is your caudal view. Occipitomental is your waters view with open mouth. where I'm using this for my sphenoid sinus. And what is the name of this view? It is your Pierce view. Occipitomental, only occipitomental given. What is view? Occipitofrontal, converse view. What is basal view? Basal view, again, one of the important points. Basal view is your submentovertical. Revise with me. What is view? Occipitomental. What caudal view? Occipitofrontal. Basal view, submentovertical. And with open mouth, we go in the favor of Pierce view. Clear? Option D. It is best for sphenoid sinus. It is best for sphenoid. Question number 13. Again, one of the important PYQ. 40-year-old female in the ENT OPD, complaining of nasal obstruction, presence of crust, mucopurulent rhinorrhea, breathing difficulty since last 1 month. On examination, black, foul-smelling crust, nasal cavity. Which of the following associated with merciful anosmia? Merciful anosmia given. Just remember bit of merciful anosmia. Merciful anosmia, always remember, if the word merciful anosmia mentioned, it is going in the favor of atrophic rhinitis. And atrophic rhinitis, there will be a roomy cavity. Clear? Again, very important. Foul smelling crust with merciful anosmia. With merciful anosmia, it is going in the favor of atrophic rhinitis. Which bacteria? That is your Klebsiella. That is Klebsiella. Drug of choice, streptomycin, tetracycline. What will the treatment? Treatment we will be, yes, you tell me what is the treatment? Treatment will be, we use antibiotics like streptomycin, tetracycline. We have to clean, just remember this point. We have to clean the nose with alkaline solution. Yes, so we use sodium bicarbonate, bicarbonate, chloride. The word keyword is merciful anosmia. Now, just learn, if examiner mention the word foul-smelling crust, merciful anosmia given, it is atrophic rhinitis. But if the examiner use a word woody nose, if the word woody nose is given, it is going in the favor of rhinoscleroma. Where is it? Foul-smelling crust, atrophic rhinitis. If merciful anosmia, if woody nose, we go for rhinoscleroma. One of the easy MCQ, a very important MCQ, old PYQ. A 35-year-old patient with nasal epistaxis in emergency, which was not controlled by nasal. Which of the following is the next step? Next step is the ligation. He's asking you ligation, which is the artery of epistaxis, sphenopalatine. Better keep my word. One MCQ and epistaxis expected. Just remember, artery of epistaxis. What is artery of epistaxis? Sphenopalatine artery. Then, what is Trotter's method? Trotter's method is pinch your nose, spit out the blood. Is Trotter's method. Trotter's trial is seen in nasopharyngeal carcinoma. Trotter's method is epistaxis. Okay, pinching the nose, control, and spit out the blood. Coming to the last MCQ, a child underwent, again one of the important PYQ. A child underwent tonsillectomy after surgery, shifted to the recovery, where he started having bleeding. It means that the recovery room means within few hours, half an hour, 1 hour, patient is having bleeding. It means it is reactionary hemorrhage. But how many type of hemorrhage we are having? Primary hemorrhage, reactionary, second. Always have a habit of making formula. What is primary hemorrhage? Bleeding on table. What is the cause? Injury to the vessel. Injury to the vessel. What is the management? Ligate the vessel. What is reactionary? Within 24 hours. What is the cause? Slippage of the ligature. Management, religate the vessel. Guys, within primary on table. Injury to the vessel, ligate the vessel. Reactionary within 24 hours, slippage of ligature, religate. What is secondary? Secondary is after 24 hours. Cause is infection. Treatment is IV antibiotics. Treatment will be IV antibiotics. So in this, I will shield the patient and will be ligating the bleeding vessel. Best answer will be your D option. Again, all these students will have very best of luck for upcoming examination. Yes, be confident. In the last few days, don't touch any new thing. Whatever we people have taught you, whatever workbooks we have given you, just revise them nicely. Don't touch any new thing. Focus on revision, revision, revision. Any query, you can ask me on the Insta. You just inbox me and reply. Very best of luck. Thanks a lot for listening.